For governments, families, and seniors themselves, the growing number of people living with dementia makes it an unavoidable challenge. What needs to be done and who needs to do it? Let's ask Dr. Samir Sinha, Director of Geriatrics at the Sinai Health System and the University Health Network, and Candace Chartier, the CEO of the Ontario Long-Term Care Association. And we're delighted to welcome both of you back to TVO tonight. How's it going?
Great, thanks. Thanks
Good.
for having us.
Happy to have you here. Let's just share some numbers that you know all too well as it relates to Ontarians and what concerns them, what they worry about. This was released a few months ago by the Alzheimer's Society of Ontario and CARP, and it reveals some very interesting polling numbers. Dementia and cognitive decline are top of mind. 67%, fully two-thirds of respondents said dementia and cognitive decline are their biggest concerns. Housing, 4 in 10 worried about. Loss of physical abilities, just under 4 in 10. Those round out the top 3 worries. And then if you go further down the list, disease, failing health, about a third. And then financial security, maybe an interesting indication of how the economy is doing. Only 2 in 10 say financial security is one of their chief concerns. And as we continue along, here's why the thought of dementia might be so troubling to people in this province. 90% of Ontarians in long-term care have dementia or a cognitive impairment. People with dementia are twice as likely to visit the ER or be hospitalized for preventable issues, and family caregivers are twice as likely to experience a psychological illness. Let's get into some other reasons as well. Candace, to you first. Why else do you think this disease is so distressing to so many people in Ontario?
Well, I think there's a couple of things. I think with modern medical technology, we're living longer. There's more advanced medicine, and there's no cure. So this is something that is only going to grow as our population grows. And if you look at people coming into long-term care, they're coming in a lot later in their life. They're coming in sicker in a much more frail state. And usually advanced dementia is there, prevalent.
It's present.
Yeah.
What would you add to that list?
And I think the greatest fear, the reason it's the top of everyone's list is it's that fear of losing independence. If you get dementia, it's an incurable illness right now. We don't have any effective treatments, and this is going to actually potentially land you in a long-term care home if you don't have the right amount of funds or the right amount of care around you to keep you independent in the community. That's scary.
We're going to do a little Dementia 101 right here. We're going to put some graphics up and we'll have you speak over them. Alzheimer's disease is, I guess, the most prevalent form of dementia that people suffer. And go ahead, Sydney, if you could put those up. Why don't you take us through this and show us what's happening in the brain?
So right now what you see is these 3 pictures of a brain that's one starting with healthy, and then as it's actually progressing with Alzheimer's disease, you'll actually start seeing that it starts to hollow out. There's a lot more what we call atrophy, where the brain actually starts to shrink and you get bigger spaces. But you also see that there's more diseased parts of the brain that reflect the accumulation in Alzheimer's disease, particularly what we call plaques and tangles.
And there's a second picture we're going to put up as well, again, showing the difference between the healthy brain on the left as opposed to Alzheimer's on the right. What are we seeing there?
Yeah, and so if you look in that circle there on the left, you'll actually see a healthy neuron, what's a basic brain cell. But you'll actually see on the right side there, you'll see these these what we call amyloid plaques, and these tangles that actually start developing. And it's almost like you're building up junk that starts interfering with the ability of the brain cells to actually communicate effectively with each other. And that's what you see in Alzheimer's disease. But every type of dementia has a different kind of process that's at play.
So let's state the obvious. There is a lot of this happening, and there is a lot more coming down the road. In which case, we want to know what, Candace, to you first, how would you describe the current state of dementia care in the province?
Well, I think that we're on the right path with the provincial dementia strategy. I think a lot of work has gone into that over the last couple of years. But what we're seeing in long-term care specifically is we're kind of stalled right now. So we're stalled in the sense that 90% of the people we're looking after have some form of cognitive impairment, and we have a large portion of those that may exhibit some form of aggressive behavior. So that's already a concern, but at the same time, we have 30,000 beds in the province that have to be redeveloped. So you have these individuals sharing really small spaces and tight quarters, which impacts the quality of living.
What does that mean? 30,000 beds need redeveloping.
So there's 309 homes in the province that aren't up to the new design standards. So you've got new homes in the province that have maximum 2 people in a room, wide hallways, lots of communal areas, wandering paths, quiet, intimate dining, where almost half you have 4 beds in a room, you have crowded hallways, you have dining rooms upwards of 60, maybe 70 people dining. So you think of the noise level, you think of all of those external stressors that would not enhance the living environment for somebody with cognitive impairment.
Do you agree we're stalled right now?
Well, I think it's a challenge, right? I think the fact is we have more and more people every day living with dementia in the province, mainly because age is the #1 risk factor for developing Alzheimer's or other dementias. So as our province ages and the number of older people are going to double, the number of people with dementia are going to double as well. And the question is, do we have the right amount of home care? Do we have the right amount of long-term care? And in terms of the type of care we're providing, are the staff even trained to work predominantly now with people with dementia? And do we have the right, as Candace was saying, if a long-term care home is designed to a standard, or it's an older home where people were meant to be living in closer quarters without cognitive impairment, it's almost a recipe for more challenging things to happen.
Demographically, apparently for the first time in our history, there are more seniors in Canada than children under 14. Think about the implications of that for a second. What is, in which case, the biggest challenge that you face, for example, as you are trying to devise a dementia strategy for governments, for community, for everybody to buy into?
Well, one of the basic things is that from a dementia standpoint, we have a lot of people, citizens, who don't even know what dementia is. They can't recognize it easily amongst, forget themselves, but amongst family members or friends. So people say, well, mom's just behaving a bit odd, or dad, and mom may have always been behaving a bit odd. But the point is that when it's actually dementia, we have a tough time recognizing it and knowing how to work with friends and family or neighbors who might be living with dementia. On the care side, we have a number of care providers who haven't been trained, #1 in geriatrics, okay, and #2 in actual dementia care. So we actually have a disproportion. We have a large number of people with dementia who haven't been diagnosed with dementia and who aren't getting necessary access to the care and support that we could be providing them earlier on in their diagnosis.
The law, I gather, that you have to deal with is the Long-Term Care Homes Act, which was passed 11 years ago. How useful is it today?
Well, I think that there's areas in the Act where there's a significant layer of administrative burden, which we are we're very excited to be working with the new ministry, with actually somebody having that portfolio. It's an immense piece of legislation. It's probably the most stringent legislation in North America, if not globally,
But just
for long-term care.
Too much regulation, too much bureaucracy?
Too much, it's just too many layers. I think what we need to do, and we've been very vocal about this, is we need to open it up, look at where we're going, look at the population we're looking after, and really determine what is required in that act and what's not.
What's your view on it?
I think part of the challenge is people who are living in long-term care amongst the most vulnerable citizens in our population. And I think the key is that when we're entrusting institutions that are publicly funded to provide that care, we want to make sure that people aren't being taken advantage of. If 90% of the residents have dementia, they are prime targets potentially for elder abuse and other issues as well. So that's where a lot of this regulation comes in. It's not that someone for fun wanted to put all these rules in place. The question is, how do we make sure that those rules don't get in the way of providing the best possible care? And I think some people will hold up rules and say that's preventing me from doing things, but we've seen a number of great examples within our long-term care homes of staff doing incredible things and homes doing incredible things because they've learned how to work with the regulation to deliver the best possible care.
I don't know this for sure, and I'm not trying to stir up trouble where none exists, but it sure seems to me like you two disagree on this. It sounds like you think those regs are there for a reason, and it sounds like you think they're not.
Well, I think that when the Act came into play, it was a very hot topic politically, and there was a review done, and I just think we went from one end of the pendulum to the other. I mean, I worked in the sector years ago where I would have my compliance advisor come in and say, oh, you know what, I'm going to be there in a week, and we would have all of our stuff ready. And it was a coaching and mentoring kind of process, where I think now we're on this other swing on the pendulum where we've gotten to a very over-administrative component where, like, you might
Let's do it
have...
for instance. How about dining?
Okay, so I was at the opening for one of our members. They're doing the butterfly concept. And I watched the video that David Sheard had up on the screen, and it was heartwarming. And I was sitting there, and then the first thing that came to my head was, how are you going to put this plate of food down and let the residents just serve themselves and eat what they want when the Act prescribes serving scoops for each potato, each vegetable? If you have the wrong juice, then you're going against the Act and the regulations.
So
and
the butterfly...
that's the first thing that came to my head.
The butterfly process actually flies in the face of some of the existing regulations.
And that's what, because of the position I'm in and the history in long-term care, that it was just basic food consumption was the first thing that came to my mind.
Okay, has the pendulum swung too far
I think
away?
Yeah, no, I think the opportunity is we should always look at regulation and say, has it become a bit ridiculous? Is it actually serving the right purpose? I agree with Candace that a lot of what I hear from my colleagues in long-term care is it's gone away from how do we help you meet the best standard of care to are you actually meeting all the regulations? And I think the one piece is that we do have homes in Ontario, the Peel Regional Homes, for example, who put in butterfly initiatives, for example, and they've stated to me, we were able to do all of that within the existing regulations. So I think the key is that sometimes people will say the regulation's preventing me from doing something, where other people say it doesn't say that you can't serve the person food and you can't be flexible. But I think the key is, I think we agree on the fact that I think the key is if the regulation's 11 years old and it's not serving the fundamental purpose it was meant to, then it's time to be reviewed.
How about paperwork? Is there too much?
Well, this is anher thing, right?
You're going to say yes, right?
Well,
Yes.
But we've had situations where we actually look at, again, what is the required paperwork that the government actually has, and then what do homes layer on top of that? And so we actually had a really good initiative that has been discontinued. I think it should be brought back, called Residents First. And Health Quality Ontario used to run this, where they would actually work with homes and say, actually, all the paperwork you need to fill out is actually these 3 forms, not, these 20 extra forms that you've created in your own home. And in one home in North York, for example, they were actually able to release 12,000 hours of personnel time when they actually leaned out the amount of paperwork that they had self-created. So the question is, I think there is is there an opportunity to review required paperwork? Absolutely. But I think also at the same time, we have to remember that a lot of people put on extra layers that actually are nobody else's fault but their own, potentially.
Are you your own worst enemy on this?
No, and I just want to jump back to the regulation piece. It is actually a good news story. So if you think of how restrictive and how we have to meet all those hundreds of standards every day, government will be the first one to tell you that like almost 90% of the homes are in really good standing. So that's a good news story. When I say administrative burden, I'm thinking of we have to report certain indicators, quality data to the LINs. We have to report
Local Health
to
Integration
the
Networks.
local health integration networks, to Health Quality Ontario, to CIHI.
Canadian Institute for Health Information. We're
Information.
trying to be an acronym-free zone
I know,
here.
I know. And so we are reporting at these levels of duplication. And I mean, you already have residents saying to the nurses in our home, I wish you could spend more time with me. You sit there at the desk and you're charting for 2 hours. If a resident is noticing that, then...
But it sounds like he thinks the regulations are in place to help you provide good service, and it sounds like you think it's just their way of policing you and it's more punitive.
No. I definitely think that the regulation is there to ensure that those 90% of homes remain in good standing and help us help the other homes that might need the support. What I'm saying is that since the Act came in, there's been layers added. And it gets to the pancake analogy. You can stack pancakes on top of each other, but eventually they're going to fall over. So you have to look at when you add something administratively around the sector, what are you going to remove? And that's what we're trying to help government get to. And we're getting good uptake, and they're listening to us. So
I think the only other thing, too, is that over the last 11 years since that last act was actually put in, I would actually say the face of long-term care has changed dramatically too,
yeah.
right? We have more and more people in long-term care living with dementia. People who are entering long-term care tend to be a lot more frail and have a lot more different needs. And so the question is, the regulation at that time might have been good and acceptable for the population that was living in long-term care at that time. The question is, as that population has changed, have the regulations changed with it appropriately?
Okay, this is not the David Letterman show, but we are going to do a top 10 list here anyway. Okay. And Samir Sinha, I wonder if you could take us through this. I'm going to give you sort of the top 10 points for a dementia strategy, and I want you to just tell us, like 5 seconds on each one, how it fits in. Number one, community dementia programs. How does this fit into the overall scheme of things?
Well, what we're trying to do is a whole system approach. So with community dementia programs, we're trying to just simply say programs that are community-based that help people learn and be supported who are living with dementia.
Number two, caregiver respite.
Caregivers provide the bulk of care more than any other funded provider. We need to make sure that they're supported and allowed to take a break.
Number three, care partner education and training.
Many people living with dementia have care partners or caregivers who don't know anything about dementia. Arming them with education and support helps them feel secure, helps them live with less mental illness, and allows people to stay at home longer.
Number four, workforce training and education.
Not a single doctor, nurse, or therapist or pharmacist is required to learn about geriatrics, and the key is that means that they're not necessarily forced to learn about dementia.
And they should.
They should.
Okay. Number five, behavioral supports at home or in the community.
Behavioral support. So this is the idea that, again, with dementia, sometimes people will actually have behavioral issues as well. So that can be from repetitive vocalizations to aggressive behaviors. And the question is, if we can actually solve some of those issues with problem-solving techniques in community, those people might end up in long-term care quicker. And if they're in long-term care, that can be a patient or a client safety issue. It could also be a staff issue as well.
Number six, behavioral supports in long-term care homes.
Just what I described. It's making sure that we're supporting people with behavioral issues in the community and in long-term care.
Number seven, evaluation of memory clinic models.
So a great model is, how do we actually get people access to accurate diagnosis and management right through their primary care offices. And so there's a great model called the memory clinic model that my colleague Linda Lee has started. It's in 100 clinics around Ontario. We want to make sure that's available in every part of Ontario.
Number eight, patient navigation.
So if you have dementia, do you know who to call? And do you know what services to access? Through the Alzheimer's Society, in year 2 of our funding now, we've actually put money to support the Alzheimer's Society through a program called First Link, where you can get access to information support around dementia.
Number nine, physician education in geriatric care.
So again, it comes back to, if I'm not required to learn about geriatrics or dementia, that's a problem. And we also don't have enough geriatricians or geriatric psychiatrists in the province who can work with our primary care providers to provide everyone the right mix of care they need.
And number 10, campaign increasing awareness.
So in many different jurisdictions, we just know that raising awareness around that dementia exists. And this is what you can do as a citizen, as a care provider, as a friend to someone living dementia. We want to decrease the stigma and make sure that we as a society are prepared to care for more of each other living with this illness.
Okay, that's our top 10 list. Candace, how do you feel about the focus of this list?
I played a part in that list, and I think it's great. And I think that the navigation piece is key. I know, just living in a small town and being in a small community, people do know how to find care in a small community, but I couldn't imagine being somebody that was struggling in Toronto and trying to find where I go, especially if you don't have a primary caregiver. So I think there's another piece too, which has to happen at some point, and that's the legal support piece. And what we see sometimes is somebody does come in and they're heading down that dementia or Alzheimer's journey, and they really don't have that support to make sure that their finances are protected and things like that. So I think there's got to be more awareness in that area as well.
Okay. We've been talking about the Ontario dementia strategy so far, but there's a federal one as well. And you're involved in that as well, aren't you?
I am. I'm on the Ministerial Advisory Board on Dementia, and that's a response to legislation that was tabled federally, I think, last year. It was a private member's bill asking for the creation of a national dementia strategy.
And is that happening now?
It is happening. So the work is now underway, and the goal is that we actually have a dementia strategy, or that the minister would like to have a dementia strategy she can table in Parliament by June of actually next year.
This is the Minister of Health.
This is the Federal Minister of Health.
Federal Minister of Health. Okay.
We're involved in that as well.
And you're involved in that. What would you like to see?
Through the Canadian Association for Long-Term Care. What I really want to see between that table is the alignment with the provinces. I think we shouldn't be recreating the wheel, and I think that we need the federal support in dealing with dementia, and so working federally with the provinces to make sure that it's seamless.
But would you, just so I'm clear on this, does the federal government in creating its national dementia strategy have to do anything beyond setting some basic standards and then flowing money to the provinces to let them do their thing?
Well, I think this is the challenge with the legislation, right? Is that in 2013 the G8 countries came together and they said that they were each going to create a national dementia strategy. So Canada's behind the U.S. and Britain.
Everybody else has
and other
got one,
countries.
right?
Not everyone,
Almost
but
everyone, yeah.
again, so Canada's in the development stage, which is good. But the challenge that we have is other countries, they control the healthcare system from the federal government altogether. Here, because we have a federated model, there has been some friction at the beginning saying, wait a minute, this is, it's the province's job to do long-term care or home care or even health profession training. So the goal that we're trying to figure out is what can the federal government do to share information amongst provinces, to maybe set some standards, some common targets, goals, maybe funding things like research. So there's a lot of different things that are being considered to say what could the federal government do and how could it leverage its role to support the provinces and territories to create some kind of national approach to dementia.
Because it is still the provinces that are, first among equals in this, I guess is the way to put it.
Pretty much, because when you think about what do people living with dementia and their care partners need, it's often a lot of the things we just talked about, which really comes under a provincial jurisdiction. But there are things, again, that I believe that the federal government has a role to play in helping to things like raise awareness, maybe provide more funding for research, or do other things that can spur all of Canada to move together on this journey.
Oh, you wanted to add?
Well, and I'm thinking, like, as a province, we're well connected, electronic health record, that technology side. One of the things we said to the federal health minister through the Canadian Association for Long-Term Care is, how can you measure across the country when there's some provinces that have no access to that technology? And I mean, technology gives us data, and that data helps support decisions. So we as a country, we've got to get on a foundation of connectivity.
We got less than 2 minutes to go here, and I want to ask one last thing. You pointed out 20 minutes ago, there's no cure. There's no vaccine. I guess everybody's working on those two things right now. But if that's the case, how big a role can or should prevention play in any of this? Why don't you, 30 seconds here, 30 seconds here.
Prevention is key. I think prevention in the approach to looking after people that have been diagnosis, and this is where I'm going to flip it to Samir, that the things that people can do to keep their brain as healthy as possible, and that's something that I stress in my own family.
Yeah, and the good news for people watching is that 20% fewer people are living with dementia today than we thought would be 20 years ago. That's because we're taking better care of our brains. We're more educated, which is a protective factor. We know that actually, repairing that hearing with a hearing aid or something will actually prevent the onset of dementia. So there's actually a lot of things we can do to prevent many cases of dementia in our society, and we should continue to do that. And right now there's some good news that maybe there's going to be some new medications that might come to bear by 2020. It's still very early and preliminary, but we're hoping that, again, if those medications are available, we'll actually have the systems in place to actually administer them and support them as well.
Meantime, diet, exercise, sleep, engagement, crossword puzzles.
100%.
All of the above. Got it. Dr. Samir Sinha, Director of Geriatrics at the Sinai Health System, Candace Chartier, CEO of the Ontario Long-Term Care Association. Really good of you to spend so much time with us tonight here on TVO. Thank you.
Thanks for having us.
The Agenda with Steve Bacon is brought to you by the Chartered Professional Accountants of Ontario, helping businesses stay on the right side of change with strategic thinking, insightful decisions, and business leadership. Are you on the right side of change? Ask an Ontario CPA.